The pandemic has highlighted many problems that have worsened now but have always been with us. But could we solve them so well that we come back stronger than ever before? And what exactly is the problem? Is it simply that we were hit by COVID? Well, we couldn't get what we needed. But didn't we have it already? 57 million stockpiled N95 masks expired just before the pandemic started. That's about $200 million worth, or nearly 2 for every Canadian. So we had what we needed, but we didn't know how to get it to where it needed to go. In fact, how long does it take a mask to get from the assembly line to the front line in normal times? It takes months for an order to go from the frontline worker needing it to the manufacturer and the package to go back again, making at least 5 stops along the way. And this delay causes mistaken over-ordering, meaning that between 20 and 40% of what is delivered to hospitals normally isn't used. On top of that, each of these stops have inventory, which means that at any time, a small fraction of what's being produced, of what you've already paid for, of what we already have, is actually being used. And that's just the ideal case, because now hospitals all over the country are sending nurses to Walmart to buy supplies and sending taxi cabs with emergency materials back and forth every week. There has to be a better way. If the real problem is that what was needed doesn't arrive at the right place at the right time, what if it could? Critical PPE infrastructure exactly where you need it automatically, directly to the front line. Your inventory and inventory management taken care of better. BetterFit takes the orders of real frontline workers and compares them against dozens of data points to determine need. Things like the number of cases, the trend of rise or fall, the capacity of hospitals, the rate of spread, and the size of the population. The most important orders are matched to their needed supplies, always to those closest to them, to save time and shipping costs in getting the frontline their critical needs. Delivery happens on time, and 5 trips or more turns into only 1. As new information becomes available, BetterFit automatically adjusts, and if you know something new, you can adjust the plan at the touch of a button. Each day, tickets are delivered directly to suppliers and supplies directly to the front line. Our interface, prototyped with dozens of frontline workers from all across Canada, lets every user keep track of their inventory, see what their teammates have ordered at a glance, and make requests when they really need it. But how can we do it? Since 2016, we've been working on our maximum match technology, a new and unique way of solving complex problems now filed for patent in 153 countries. Instead of first come, first serve, we match real-time supply and demand based on priority. Predictive analytics work just great until, well, something unexpected happens, which in healthcare is happening all the time. BetterFit's unique real-time solution remains adaptable in the face of anything, even your changing needs. This allows us to shorten delivery times and costs by as much as 80%, getting more of the product you already paid for to where it can be used. BetterFit not only handles emergencies, it's built for them. If requests are higher than supply, BetterFit automatically adjusts, making sure those most in need get what they need most and distributing limited resources equitably for everyone. Once we're out of the hole of limited supplies, it doesn't stop there. BetterFit can cycle through stockpiles, eliminating costly inventory blockages and making sure everybody gets just what they need when they need it. We've already received support from governments and are integrating with some of the largest companies in the world. And this is just the beginning. BetterFit's unique maximum match technology can deliver the same gains for all medical supplies, for materials in any supply chain, and even in the scheduling of patient treatment backlogs. In fact, all of these problems are not only big and complex, they're connected. BetterFit works better as things get more complex because it's built exactly the opposite of anything else. As things change and as complexity grows, BetterFit's matches get better. That's the power of maximum match technology. Shipping, supplies, timing, complex connections don't have to hold us back. They can offer big opportunities. It's only when we solve all of them together that we could tackle any one of them. And BetterFit is the only way to do just that. What could you do with more supplies in a fifth of the shipping time, with more patients getting better care? What could you do with a better fit?